Yeah, it's morning. Good morning, everybody, and I really wish to thank the organizers, but particularly Dr. Kannan Yalikar for inviting me to speak on a subject that's very, very close to my heart. Thank you. Right. Thank you. When I read about her life and what she's achieved, and I'd love to give her a hug, I was blown away by her achievements. So when she personally called and asked me, would you talk? I was absolutely humbled, and I do think this is a huge privilege. She asked me what topic, and I said, can I speak on women's voices for a safe and positive birth? Ladies and gentlemen, I'm not sure how many of you know that for the last 8 years, I've been out of mainstream obstetrics, but focusing on low-risk, uncomplicated pregnancies that form 80% of our population. And I've been training midwives and learning more about midwifery. As a result, my understanding of physiology of labor has done a 180-degree turn. And all that we were taught, I have taken out of my head and had to relearn things. So today, I quote this young lady, and I stand here not to shout, but to speak on behalf of all the women you and I are so privileged to serve. But because of our training, we have unknowingly traumatized some of those women. And let's see what we are talking about. Let's start with a very basic fact, which I've learned more and more in the last 10 years. The way in which you and I are born, the way I, as a mother, give birth, is going to affect me for the rest of my life. If I have a positive birth experience in the loving care of people who respect, give me that privacy, listen to me, treat me with kindness, it doesn't matter. Even if I have a cesarean, I would go away thinking that I was looked after. But if I have a negative experience, traumatic, and we're not talking about tissue trauma, but psychologically, then I don't enter motherhood on a positive note. I suffer from post-traumatic disorder. I go into depression and possibly not want to have another child again. So these are very defining moments in the lives of women. And it's not just the mother, it's her husband, her relationship with her family, ultimately the community and society. So we're not surprised in 2014 when WHO said, every woman has the right. And I draw your attention to dignified, respectful care. And last year, in 2018, WHO gave us guidelines, and they don't talk about anything high-tech. They talk about respect, they talk about a companion, and to give the mother a listening ear. They even brought out very clear guidelines. And the first thing in the guideline on intrapartum care, they said, keep birth natural, keep it physiological, which we, at least I as an obstetrician, 22 years into practice, thinking I was at the crest of my career, I realized that I had actually forgotten physiological labor and birth because we hardly saw it, we hardly practiced it. And it's with the midwifery that I learned it all over again. The ability for a woman to give birth without any intervention is very powerful for the woman. So what are we talking about? Physiological birth? Let the woman set into labor spontaneously, no restriction on time, so your partogram may go into many pages. It doesn't matter, you're not looking at your clock or alert line. As long as the mother and baby are fine, she can walk around, she can eat and drink, she can birth in any position of her choice. We were all trained to have mothers on the flat of their backs with legs in stirrups. We don't do that anymore. Delay the cord clamping, keep the cord intact, let her have her baby on her chest, let the placenta come out on its own, and she has an absolutely physiological third stage, which you and I were never taught to see. But what we were taught is start an IV line, do an ARM if she doesn't progress, start oxytocin, she gets a lot of pain, give her an epidural, and ultimately she may end up in a C-section, all because you and I have interfered. And I'm guilty of that. So what matters to women during childbirth? And a systematic qualitative review, they said clinical and psychologically safe environment. And I stress the word psychological. We're talking about majority of our mothers. We're not talking about high-risk moms. And emotional support from whoever is there around me, be it a birth companion or the staff. Now, on the other side, India is progressing in maternal health. We've got choices for urban women, any of the chain of boutique hospitals. But even in our boutique and private hospitals, women feel that they are not being heard, that we are not listening to what they want. And Dr. Alpesh just spoke about the good things that are happening with the HDU. But with 26 million births a year, and the government asking women to come into the institutes, this is what they come into. And this is what they see. I draw your attention to the fact that a woman has to pay to get her baby back after the baby is born. And this is an amazing blog written by a woman who actually stayed in all night in a busy hospital in Kolkata and watched what was going on. So women say, it doesn't matter how I give birth, but what matters is how I was spoken to, looked at, talked about, disregarded, not listened to, not trusted, not believed. And I'm guilty of that. I remember if a mother said something, I thought I was the great doctor who knew it, and I wouldn't really listen to her. Now, the hallmarks of a birthing space is privacy and nurturing love. A lot we can learn from the animal kingdom. If we've had dogs and cats in our homes and they littered, they would always find a dark, quiet place and go and give birth. And the core requirements for mammals is private, safe, and not being observed. You and I are mammals. And look at this picture of a herd of elephants protecting their female colleague who's birthing in that protective ring. But what do we offer to our women? We have a room that has lots of lights, lots of people walking in and out, and in some of our public hospitals, we don't even have curtains, so the genitalia is exposed, and there's no dignity or privacy. Now, there are amazing studies that have been done on the emotional support, and they say that if she has a birth companion, and it could be a midwife, a doula, or her husband, there's less chances of intervention. This is an amazing study done about 2 years ago, and it said obstetricians and midwives require a deeper understanding of the emotional aspects of childbirth. And that is something we hardly give thought to because we don't have the time. We're doing 500 things in a day. I know, I've been there. OP, theater, rounds, still looking after a woman in the labor ward. You're all over the place. And therefore, our decision making is affected. We're not able to give that emotional support to the mother. And that's why midwives are required. All staff, whether it's a nurse, midwife, doctor, registrar, should be aware that her persona, the way she handles that mother, is going to affect her labor, because I can turn on the oxytocin or turn off the oxytocin in that laboring woman just by my attitude, if I'm angry, irritable, or supportive. So this study shows that women tremendously, if they are aware, given childbirth classes, and we're not talking about urban women, we're also talking about women in public hospitals. Women would prefer to be with their families when they are in labor, not in isolation on the floor or on the bed. They prefer to walk around, keeping life normal. And as labor intensifies, and if some of us would remember, women go into a zone, and if you are there, they may actually tell you, "Don't touch me." And she'll close her eyes. She's in a totally different planet because she's focusing so much. We are surrounding her, but she's not in touch with us. And if you leave her alone, the minute she feels the urge to push, she does it. I don't have to tell her. And this is the joy of physiological labor. If only we, the obstetric fraternity, can be taught to step back and watch this amazing experience of a woman birthing without us interfering. And these are what women describe. My birth left me feeling empowered. Midwives were extremely patient and let me respond to my body instead of telling me what to do. So in the last 2-3 years at Fernandez, we've stopped telling mothers to push. It's a quiet room, the lights are low, absolute calm. There's only one voice talking to the mother. She says, "I would never give up this for anything." And at the end of the study, women expressed absolute confidence in themselves. Are we, the obstetric fraternity, giving them that space? It's not just India, globally. In England, they found that fewer than 50% of women get the birth they want, and some of them were not even asked or for consent for an AVD. And what happens to a woman if she's coming absolutely determined to have a vaginal birth and she needs a cesarean? Obviously for good reasons. We're not talking about unreasonable C-sections, but mentally she's not prepared. Now there are enough studies to show that her bonding is affected. So in the last 5 or 6 years, what we've been doing is actually talking to the mother the next day and asking her, how did you feel about your birth experience? Did you think we were listening? Do you think we bulldozed you into doing things? And it's amazing what you will learn when they talk to you. So a lot of women who are traumatized by an unexpected C-section find a lot of healing through a VBAC. And that's why it's so important that we keep our minds open to a VBAC. A lot of mothers have a lot of stories, but they don't know who to talk to. And some of them probably think this is the way birth happens. And trauma can make them very quiet, fearful. And the worst trauma is when you can't talk about it. And women talk about their birth experiences years later. What I discovered on this journey, and that hit me in like a solar plexus punch, that women remember every aspect surrounding their birth. So our words that we would have spoken 20 years ago, they would carry in their hearts. So it's so important that we provide that space for them. And the government with WRA had this campaign 2 years ago. What is it that women in India want? And they spoke to 150,000 women across the country in the north. They had 24 states and union territories participated just to find out what is it that women wanted. They collected this data and gave it to the policy makers. And 2 out of 10 women asked for dignity and respect. And many, many other countries participated in the similar campaign by WRA. And at the Women Deliver conference, you had different countries talking about what women want. And you'll be surprised. Kindness, respect, information. Tell me before you touch me. Tell me what you are going to do before you put your fingers into my body. Explain to me. The poorest of the poor women are asking only for kindness, respect, information. Clean facilities, a birth companion during labor and birth, and the freedom to move around. And it really breaks my heart every time I go to our teaching hospitals, public hospitals, and find women on the flat of their backs, not being allowed to walk around. We need to change. There is a movement that's begun by the women, and it's growing across the country. We need to believe that the women we serve can birth, and we need to open our minds to midwives. I'm sure you are aware of a growing lobby of birth networks across the country. You've got Birth Network Mumbai, Birth Network Bangalore, Birth Network Delhi, Birth Network Coimbatore. And these are ordinary women, not the elite, but ordinary women who are coming together and saying, we want a different birthing experience. And we already know, and we've suffered with this story in social media. So the Telangana government had asked us to train 30 nurses, and these are all the midwives at the end of their 18 months, absolutely raring to go, because we have enough data in Cochrane that says when you have midwives, there's less intervention and women are definitely happier, apart from all the good positive things. So at Sangareddy District Hospital, midwives took childbirth classes for our women while they were waiting to see the doctor. And just look at the joy on the faces of these women, because we are teaching them how to handle pain. And if you sway during labor, you can handle pain, and that actually helps the baby to go down. We introduced gym balls to handle pain because there's no epidurals in public hospitals. And gym balls were a great favorite among the mothers. But this is my favorite slide. 1,400 women were birthed in 5 months by these qualified midwives, and not a single mother was on the flat of her back. 64% of them were sitting upright with their knees on the table, not in stirrups. And you had all fours, knee-chest position 4%, and left lateral in squatting. And this is something that you and I were never taught to do. This is another lovely slide of a woman who's just enjoying skin to skin. And that's why the government has now decided we need midwives. I'd love to play this little video for you.
ముందు చూసింది అయ్యిందన్న నాకు రెండో ఫ్యామిలీ లేబర్ రూమ్లోకి వెళ్ళిన తర్వాత కేసు ఇలా మిడ్వైఫ్ ద్వారా నన్ను రిసీవ్ చేసుకున్నారు. పెయిన్స్ బాగా వచ్చిన తర్వాత ఎక్సర్సైజ్ చాలా చేయించింది, స్ట్రెస్ చాలా తగ్గేది, పెయిన్ తగ్గేది చాలా. డెలివరీ టైం బాగానే ఉన్నా కానీ తొందరగా డెలివరీ చేయించింది మేడం. కుట్లు ఒక కుట్టు కూడా వాడకుండా మంచిగా నార్మల్ డెలివరీ చేసింది మేడం. చాలా హ్యాపీగా ఉన్నాను.
So she's talking about a midwife.
దాని ఎక్సర్సైజ్ మంచి సలహా, స్టెప్స్ ఎక్కువమన్నది, బాగా వాకింగ్ చేయమన్నది. అసలు ఎక్స్పెక్ట్ చేయాలి नॉर्मल అవుతుందని చెప్పి.
पोस्ट वेट हो गया था मेरा, तो सर्जरी को लेके जा रहे थे. मिडवाइफ आए, मर जाओ सर्जरी को बोल के, बाल एक्सरसाइज, ब्रीथिंग एक्सरसाइज, स्ट्रेचिंग एक्सरसाइज, मेरे को पेन रिलैक्स हुआ, मेरी नॉर्मल डिलीवरी करे, हैप्पी हो गई मैं.
And this 3 women in a public hospital, absolutely physiological births, all because of the midwives. Sorry, let me just... So, humanized birth is what we need to look at, where the woman giving birth is in the center and in control. Now, with this movement that's growing across the country, when women are aware of their rights, the next step they will demand. And that is going to shake the power between the doctors and the women. And before it becomes a revolution, I make a humble plea for all of us to stop and reflect. and see how we could change our childbirth practices. And one absolutely important step is to open our minds to work with midwives. Professor Sue Down is a researcher in midwifery, a person I've grown to admire and respect. And she says, safety and personalized care is the bottom line. What do women need and want in pregnancy? Both. It's not this or that. They want a good outcome, a good experience, both for the woman and the baby, present and future. If there's medical care and support for physiology and honesty and a recognition that she can indeed do it. I'd like to quote Madeleine Albright. It took me a long time to develop a voice, and now that I have it, I'm not going to be silent. It took me 22 years as an obstetrician before I realized I had to change, or we had to change. And I believe that if we work together, we will bring out an absolute revolution in this country, because women need to be treated with that respect, dignity, and 80% of our mothers, low risk, wish to have a normal birth only if we can step back and let them get on with it. And with that, I invite all of you to the Normal Labor and Birth Conference in October. And this is where we are doing a lot of research on how we can make birth more positive and safe. Thank you.